Hi friends, a very good article in Times of India again, and it is about the budget that is coming in the beginning of 2017. And the article is Budget Ideas for the Finance Minister. So, various experts have given their opinion, and I'll read it for you. One opinion is by Shrikant Minakshi for retirement savings, by Poplar Nilesh Shah in the stock market, Jain Manglik, President Retail Distribution, Religare. Then we have expert opinion by Manoj Nagpal from Asia Capital. Then we have Abhishek Mathur from ICICI. Then we have opinion from Sudhir Kaushik, CFO of the taxpanel.com. We have an expert opinion from Kuldeep Kumar, who is from PwC. Then we have from Divya Baveja, Deloitte. Then we have an expert opinion from Star Health Insurance, Jagannathan. Then we have an expert opinion from Anshul Jain, Managing Director of India Cushman Wakefield. Okay. So now the one I like the most. So I'm a doctor myself, so I'll take an expert opinion from CMT Star Health Insurance, and that is Jagannathan. He says great hospitals and fixed charges for procedures. Most people in this country are unable Most people in this country are unable to afford quality medical treatment. Keeping this in mind, the government should enable grading of hospitals and fix package charges for various procedures, which will help the public opt for treatment of choice. Well, friends, I'm myself from the private hospital and a corporate hospital, and already there are packages for various procedures available. So government fixing those package is his opinion. Okay. The deduction limit for health insurance premium under section 80D is low. Okay. So he means to say the limit for health insurance should be exceeded. So presently, as far as I know, it is around 20,000. So it need to be increased. Here I agree. It really need to be increased. 20,000 premium if you have a family of four is very less. Healthcare costs have shot up dramatically, and one must buy a large insurance to be able to cover the cost. Agreed. The budget should provide 100% exemption for the actual premium paid. Okay, especially for the youth without any cap. This will facilitate an increase in the number of people buying health insurance. Well, Mr. Jagannathan is from the health insurance industry, so he is saying what will be in favor of his area of field, and that is health insurance. I do agree, but here I would like to add that government should come out in a way wherein all government hospitals should have a department where people by paying more can have some good services. Even now we have Indore, Delhi, AIMS, where private blocks are there and where the charges levied are slightly higher than those in the normal areas, and the services are good. But what I like to emphasize is in the government hospital itself, there should be another category where people, those who can afford to pay, especially those who have health insurance, they should be levied charges which are, if not as good as or as same as the private hospitals, but they can charge them slightly lesser than private hospitals and ask them to be covered under the health insurance. So there will be many who will be happy getting treatment from AIMS, Indira, or other hospitals, and showing up their health insurance card and getting treatment. So a person who is suppose presently getting treatment for rupees 1000, and even if you pay 10,000, that is 10 times more, but buy a health insurance card, he will still be very happy because the same treatment in a private hospital or a corporate hospital would have cost him 50 or 70,000. So 1,000, 10,000, 50,000. There's a lot of difference. So those who are paying 1,000 in government hospitals are basically subsidized. So open a private lobby or a private kind of atmosphere in government hospitals where people pay in by health insurance card. So this was one thing I would like to add in this area. The other expert opinion I liked was of Mr. Nilesh Shah, wherein he says that the bonus, the bonus shares, the cost of bonus share is counted as zero rather than as proportionate part of the original cost. This creates a cottage industry of bonus stripping causing thousand. Here he says that the bonus shares issued by various corporates, multi, multinational companies, listed companies. Basically, here the government is suffering because they are not getting tax out of it. So I agree with Mr. Nilesh that government should look into it and avoid its misuse. Other thing I liked of his was small entrepreneur sells his business, he has to pay tax on it. However, when a big industrialist sells his business through the transfer of listed shares, he doesn't have to pay tax. Now, this is also an irony that if a small time businessman sells his business, he has to pay tax. Whereas, if an industrialist is of a very high fi listed company, he sells his shares, part of shares, and still he is not paying any tax. So, this is a very good suggestion from Nilesh. This must be taken care by the finance minister. Then I like the Jayant Maglik's idea that equity investment by India is very less. So governments must do something to encourage the general public to increase its investment in the equity shares market. Then I like the idea of hike overall deduction limit to 3.5 lakh. So Mr. Mathur is saying, and I do agree, that in the current scenario, the government should raise the limit from present 2 lakh to 3.5 lakh with respect to ATC. So this will encourage, as Mr. Manglik said, public will be interested to invest in shares. Exempt senior citizen from TDS. Agree. Then one thing, generally I do not love criticizing people, but then here it should extend LTA benefit to international trips. But here Mr. Kuldeep Kumar, I don't know. My dear sir, LTA is something which is generally benefited by government employees or those employees who are working for very high-fi multinational companies where the HR policies are very sound. But very sorry to say, if any bureaucrat is listening, if any politician is listening, and to all my Indian friends and citizens, that in India the implementation of law is very lackluster. There are many in good companies who are not even getting the maternity benefits, forget the LTA benefits. So those who are working in private sectors, including people like me who are working in very good hospitals in private sector, At times you do not even get the benefits of leaves, forget the maternity leaves, forget the LTA. So people are really the sufferers. So a person like me, a professional, can face the suffering. I wonder what my rest of my Indians must be facing. So please, please do not think on the lines of a government employee. Government employees are the king of Indians. Damad, sarkari damad. So please do not talk about LTA benefits. uh, Higher deduction for first time home buyers. Now here I agree with Mr. Anshul Jain. In India, people have misused many things of the government. So first, many are not having houses. So first time house buyers definitely must get some benefits. Here I agree. So that was all. So hope the apple falls in the right direction in the right place, and good ideas come into our mind of Mr. Finance Minister.